Ruby the Red Blood Cell and Her Journey of Blood Flow Through the Heart by Abby Ann Russell. Starting in the body, Ruby is now going towards the superior vena cava, which is the large vein which returns blood to the heart from the head, neck, and both upper limbs. The inferior vena cava returns blood to the heart from the lower part of the body. The right atrium receives deoxygenated blood from the body and then empties the blood into the right ventricle. The tricuspid valve sits between the heart's two right chambers, consisting of three thin flaps of tissue called cusps. These valve flaps open to let blood flow from the right atrium to the right ventricle. This prevents backflow from the right ventricle to the right atrium. The chordae tendineae are thread-like bands of fibrous tissue which attach on one end to the edges of the tricuspid and mitral valves of the heart, and on the other end to the papillary muscles, which are small muscles within the heart that serve to anchor the valves. The papillary muscles are muscles located in the ventricles of the heart. They attach to the cusps of the atrioventricular valves via the chordae tendineae and contract to prevent backflow. The right ventricle pumps deoxygenated blood to the lungs. In the lungs, the blood then gets a refill of oxygen. Now this is where Ruby runs into a problem. Ruby has come across a ventricular septal defect, also known as VSD, which is also known as a hole in the heart. A ventricular septal defect is a birth defect of the heart in which there is a hole in the wall, septum, that separates the two lower chambers, also known as the ventricles, of the heart. The hole occurs in the wall that separates the heart's lower chambers and allows blood to pass from the oxygenated left side to the deoxygenated right side of the heart. The oxygen-rich blood then gets pumped back to the lungs instead of out of the body, causing the heart to work harder. A ventricular septal defect is a common heart defect most often present at birth, but can occur in adults after surgery or a heart attack. If there were no defect, Ruby the red blood cell would continue in her blood flow path like this. The pulmonary valve is one of two valves that allow blood to leave the heart via the arteries. It is a one-way valve, meaning that blood cannot flow back into the heart through it. The pulmonary artery carries blood from the right side of the heart to the lungs. It transports deoxygenated blood to the lungs to absorb oxygen. In the lungs, the blood is supplied with oxygen, and the oxygenated blood then flows back to the heart through the pulmonary veins. The pulmonary veins are blood vessels that transfer freshly oxygenated blood from the lungs to the left atrium. The left atrium receives blood full of oxygen from the lungs and then empties the blood into the left ventricle. The mitral valve is also known as the bicuspid valve. This is one of the heart's four valves that help prevent blood from flowing backward from the left ventricle to the left atrium as it moves through the heart. The left ventricle is the thickest of the heart's chambers and is responsible for pumping oxygenated blood to the rest of the body through the aorta. The aortic valve lets blood from the left ventricle be pumped into the aorta, but prevents blood once it is in the aorta from returning to the heart. The aorta is the main artery that carries oxygen-rich blood away from your heart to the rest of your body. The blood then goes to all of the organs and systems in the body and is now deoxygenated. The deoxygenated blood travels back to the heart through the superior and inferior vena cava. The blood now goes back into the right atrium and the cycle starts again.